So I was listening to Joshua Phillips today from Epoch Times, his show Crossroads, and he was saying how he doesn't really understand why the Biden administration or any of the leaders on the Hill aren't saying the truth about why the border isn't secure, won't be secure. And it's because they signed on with the UN years ago. It's of public record. So I'm just wondering why even the Republicans aren't really speaking about that. It begs the question, especially since it is public record. It's part of the Agenda 2030 and the Unsustainable Development Goals that all the hospital CEOs got on board, which is why they're all hiding. Yes, many of them are retiring. They're moving ones in and out, or really they're working from remote states, which they're really not working. And a lot of them are coming under fire for how bad their hospitals are. But the problem is that most of the hospitals they're all funded now by private equity firms, which is why there's unsafe conditions, there's not supplies. You just have people that don't care. But furthermore, it's the hospital CEOs that signed on to open borders. So when I say that there's so many people in America, and even Joshua Phillips said this, they betrayed this country. Please understand that. They didn't just make an error. They didn't just, it was a bad business decision. No, they signed on to an agenda to take sovereignty away from American people. That's what greed did to them. And then to hide, they moved the CEOs in and out. At least at the real big hospitals, they do. They move them in and out, or they move out of state because they know their staff will likely come hunting them down, wanting answers. And so they move out of state. In fact, one hospital recently, just today or in the last day or two, it's been mandated by the court that he has to move back from Tennessee to Philadelphia. He's been being a CEO by remote work. But a mother died there after giving birth, and it was all these safety reasons why it happened. So, yeah, they don't want to show up in the hospital because they know what they're doing. They know they're deadbeats. And it's just why they keep moving them out. But these are the people, along with these professional organizations, that betrayed this country. This wasn't just a business decision they made. It wasn't. They knew what they were signing on to. They knew that open borders was to destroy our systems, our healthcare system, our education system. It was to kill our people. They knew. That may be so hard for Americans to believe because you think that people are like you. That's the hard part for me. But honestly, not everybody is. And the people that have this disease of greed, as I've said, they don't care if people get killed. They could care less. I mean, here's what's interesting where I'm working right now. I've said how bad it is. A girl the other night when I was working at 3 a.m., her car was stolen from the lot. It's the second time a nurse had their car stolen. So this hospital will have all these cameras to watch every move employees make, but it's in a dangerous neighborhood, but nothing in the parking lot. So that, and then they go as far, this is why I can't stand, there's chief nursing officers I just have no respect for, one being at this place. Then they want to send out emails that if you're on the night shift and you park in, say, like the handicap spots, because we're not a full hospital, we're just a psych, it's a freestanding psych facility, so people aren't going to be using like the handicap spots in the middle of the night if they're coming in. Yet, and there's so many of them on top of it, but it's closer to the door to get into the building. And yet everybody was told that you need to not use those spots. So they don't even want to they make it clear they don't even want to keep you safe. Because you can easily get hurt in this area, especially if you work on night shift. So it just would be the safer thing that people be allowed on night shift to park right near the door so that just for safety reasons, but nobody seems to be considering safety these days, not at all. Clearly not at all, not chief nursing officers, certainly not CEOs and board members and all the people that have allowed the healthcare system to be run by private equity firms. These are the biggest, worst people. They just really are. The amount that they allow, the damage that's being done to America because of open borders is only going to get worse. And they are a part of the responsibility for it. And they have tied it around this big bow that it's about equity and inclusion. No, it's about the only equity to them is about the private equity firms. They don't care what they have to do. They're the biggest damn liars. I don't think that they could tell the truth if they tried, these CEOs. And there's so many of them that come in and out. I think some of them honestly leave because they realize how bad it is. They realize how dirty it is. And so the people that really have a moral compass don't stay. But most of them that get voted into these CEO positions, they're just going to be the same deadbeats as that were there before. It's just shocking to me that, that nobody's calling out all of this. I guess it's probably because many of the politicians on the Hill, they've taken, on the right and the left, they've taken kickbacks. They've gotten funding from American Nurses Association, American Medical Association. All of these people, these politicians, these CEOs, these professional organizations in healthcare, are destroying our country right now, and they knew they were doing it when they signed on with the UN. See, to me, I would never sign on to a healthcare plan with the UN as a global anything, because you're signing on with a bunch of Communist Party countries. Do you mean to tell me nobody in the nursing professional organization or the hospital association knew that when they signed on to their global citizen bullshit health, that they were signing on with communist countries that torture and brutalize their people? They thought that would be good for global health. They thought that would be good for America. That's how stupid these people are, because all they see is dollar signs. And then again, they get the lackey chief nursing officers. Not saying all of them are lackey. I'm just saying that most of them don't have any power. And then they just are a lackey puppet for these bastards. And so those people don't see that. Those people aren't nurses to me. They're just, they're administrative nurses. Let's just put it bluntly, which means they're not putting the nursing part of nursing first. Yeah, they just want to look good in the criminal's eyes. How nice. Yeah, I could really care less what any of these fucking people think of me. What they have done to this country shocks me every single day, and it's heartbreaking. It's heartbreaking that such sick people at the top of the very toppest of leaderships and board members thought that they somehow were given a right. And they bring it on the heels that this is so good, but they think they have a right to destroy this country. I hope every single one of them, the CEOs that have been, like all the ones that have come in and out of Northwestern or any of these big hospitals, I hope every single one that's come and gone is investigated when Trump gets into office. I really do. Because we need accountability. I mean, legally, there must be accountability, and the truth must be seen for what it is, because healthcare is no longer what we used to have, and it's because of greed, the disease of money, and what it's done to these sick bastards.